Thank you for participating in the training for the new employment rates for provider agencies. These rates will include job coaching, discovery, and job development. These rates will be effective November 1, 2016. The first rate we'll discuss is job coaching. Job coaching as a service is the support for an individual to maintain and advance in an individualized job in a competitive integrated employment setting. This means it happens in the community, not at a provider-owned, operated, or controlled setting. For instance, it may happen at a community business such as a law office, Walgreens, or other type of setting like that. In order to qualify for job coaching services, the job must also pay minimum wage or better. Job coaching, more specifically, is the support provided to an individual who's working in a community job to help them maintain or advance in their job. Supports provided may include help learning the job, helping to develop communication and appropriate relationships with others in work, helping to coordinate with the residential provider, transportation provider, natural supports if there are behavioral services, coordinating those. It also is important that the job coaching service help develop natural supports and other on-the-job supports such as peer supports for the individual to be able to maintain their job long-term. Beginning November 1, 2016, job coaching services may be paid to provider agencies in 3 phases: initial, ongoing, and maintenance. It's important to note that these rates are just for provider agencies, not for personal support workers who are providing job coaching. First, let's talk about initial job coaching. Initial job coaching was originally implemented in September of 2014. When it was originally implemented, it was based on the hours the individual or the participant worked, not on the hours of direct contact with the individual by the provider. So if an individual worked 20 hours a week and the provider provided support for that individual 10 hours a week, the initial rate would be paid for the 20 hours that the individual worked rather than the 10 hours that the provider provided the direct support. As we talk about all of the job coaching rates, you will notice that just as when we rolled these out September of 2014, they continue to be paid based on the hours the individual or the participant works. The reason for this is it's considered an outcome payment, meaning we're trying to incentivize increasing the hours the person works and increasing the reliance on natural support or unpaid support. We also talk about this as the fade or fading out of a job coach. So the goal is really to help the person increase the hours that they work and help them do so without the continued support of a job coach. When initial job coaching was rolled out September of 2014, it was allowed for a total of 6 months. That means that it's 6 months no matter who provides the payment for the support. In addition to the Office of Developmental Disability Services, or ODDS, Vocational Rehabilitation, or VR, also pays for some job coaching support. At some point, when the individual is determined to be stable in their job, meaning they're working the hours they want to work, it's a good job match, and the team agrees that the person can transfer to ongoing supports, then the Office of Developmental Disability Services will take over paying for job coaching. Initial job coaching can be paid again for a total of 6 months. That means that if vocational rehabilitation funds the job for 3 months, there are 3 months remaining of initial job coaching to be funded by ODDS. Originally, when initial job coaching was rolled out in 2014, there was no requirement for direct face-to-face contact. Rather, what was required, what was outlined in the individual's plan or service agreement. However, what's changing and what is new is as of November 1st, 2016, initial job coaching requires 4 monthly face-to-face or direct contacts. These contacts must be face-to-face. However, they do not have to be on the job. Some individuals prefer to get their job coaching before they go to work, after they've been to work, or if something has happened at work, they may want to discuss that with their job coach. So while the direct contacts must be face-to-face, they do not have to occur on the job. It's also important to remember that because this rate is an outcome rate, the Centers for Medicaid and Medicare Services, or CMS, who is our federal funder, is requiring us to track the actual direct time or face-to-face time as well as the hours the individual works. We already have a mechanism to do this in Plan of Care, and we are requiring providers to continue to enter the direct contact time that they spend with the individual. This is critical because CMS will do annual reviews or audits of this, and if there's a significant difference between the assumptions we made in the rate of direct contact time to the hours the person works, CMS will require us to change our rates. So it is critical that any direct time spent with the individual, even if it goes above the required 4 monthly face-to-face contacts, is documented in Plan of Care. We issued this guidance in 2015, and additional information can be found in Action Request 1540. After an individual has received the total of 6 months of initial job coaching, they may continue into what is called ongoing job coaching. Similar to initial job coaching, ongoing job coaching was also initially rolled out September of 2014. Just as with initial job coaching, ongoing job coaching is also paid on the hours the individual works, not on the direct contact time. This will continue in the new rates that were beginning November 1 of 2016. What's new for ongoing job coaching is that there will also be a direct or face-to-face requirement. Starting November 1, it will be required that there are 2 monthly face-to-face or direct contacts provided by the job coach with the individual. Again, these do not have to take place on the job, but must be face-to-face and must be job coaching in nature. Just as with initial job coaching, the direct contact time must also be recorded in Plan of Care, as CMS will also review to ensure that our direct contact time and hours the individual worked assumptions in the rate continue to be accurate. Additionally, just as with initial, there is a time limit for ongoing job coaching. This is one of the things that is new about ongoing job coaching. Previously, there was not a time limit for ongoing job coaching. However, moving forward, there will be a time limit of 18 months. That means that if an individual requires job coaching past the 18 months of ongoing job coaching, a different rate called the maintenance rate must be requested. Again, as discussed previously, the intent of the rate is to encourage a job coach or provider to fade to natural supports and other on-the-job supports that are not necessarily ongoing job coaching supports. The intent of job coaching really is to help the person be able to do the job without support. That's the reason that CMS has emphasized that we need to make sure that our ongoing job coaching does not continue indefinitely. However, ODDS recognizes that some individuals may need job coaching past the initial 6 months and ongoing 18 months for a total of 24 months or 2 years. For that reason, we've also implemented a new rate called the maintenance job coaching rate. It's also important to note that because ongoing job coaching rolled out September of 2014, the maintenance job coaching rate will apply to anybody who's gotten 18 months of ongoing job coaching since September 2014. As with initial and ongoing job coaching, maintenance job coaching is paid based on the hours the individual works, not based on direct contact time. However, the job coach or the provider agency is required to provide job coaching as outlined in the individual's career development plan, including key steps, service agreements, and provider implementation plans. Just as with initial and ongoing job coaching, providers must also report the direct contact time that they spend with the individual in plan of care, as CMS will also be reviewing this rate and the assumptions made of direct contact time to hours the individual works based on the rate. The career development plan, key steps, implementation strategies, and service agreements become particularly important in this part of job coaching, because in order for an individual to enter into the maintenance job coaching rate, the request must be made of ODDS for maintenance job coaching. In order for ODDS to best understand what type of supports are required for the person to continue to be successful in their job, these supports need to be outlined in the career development plan, provider implementation strategies, or service agreement. Maintenance job coaching is requested by the service coordinator or personal agent. Typically, this request is made if the individual as well as the employment team agree that the individual will need job coaching supports past the initial and ongoing job coaching. So this will usually occur when the person has already received a total of 2 years of job coaching. There may also be times when the individual does not require the 4 contacts that are required by initial or the 2 direct contacts required by ongoing, and so the team may make an early request for maintenance job coaching if the support the individual needs is less than the 2 required direct contacts provided in ongoing job coaching. Most often, though, the maintenance job coaching request will be made after the person has exhausted the initial and ongoing job coaching supports. Maintenance job coaching requires the service coordinator or personal agent to document how the service is job coaching versus activities of daily living. Additional information on the difference can be found at the end of this PowerPoint, as well as in the Worker's Guide around job coaching. For instance, activities of daily living, or ADLs, may be basic personal hygiene, assistance with toiling bowel bladder care, mobility or transfers. Some individuals on the job will require this as their primary support ongoing. For instance, some individuals may need assistance with their food when it's time to eat. Some may also need some assistance in the restroom or that type of support. This would not be primarily job coaching support, and would be a time when the team could decide to continue with ADLs and IADLs rather than request maintenance job coaching. However, if it's determined that the individual does continue to primarily need job coaching support, then the maintenance job coaching rate may be requested. This rate is requested by sending a request to the Office of Developmental Disability Services at maintenancejobcoaching.request@state.or.us. This is outlined in an action request as well as in the PowerPoint. What's required to be sent is the name and prime of the individual, the name of the provider, how long the individual has been supported in their current job, information regarding how job coaching has been stepped down or the job coach has faded and the result. If, for instance, fading was attempted but not completed, why not? There should also be a description of the coaching supports the individual still needs to continue to be successful at work, and more specifically, how the job coaching supports are not ADL, IADL supports, but really supports to help that person maintain or advance in their job. Should also include the duration of the maintenance job coaching rate being requested. Maintenance job coaching may be requested for a total of 1 year. However, some teams may decide to request for a shorter period of time. The proposed plan for the job coach to provide supports and implement skills as well as natural supports to allow the job coach to fade. A description of the job coach's needed communication with the individual at work, including the individual supervisor and, if applicable, key coworkers, and how the service will be monitored. This information is information that likely will need to be collected through a conversation with the individual as well as their employment team, including their employment provider. The employment provider may have some details around the job coaching support and supports that they provide to help the person be successful that need to be documented. In order to facilitate this conversation, ODDS has included a maintenance job coaching request form, which is attached to the transmittal that can be used to help facilitate this conversation. Either the form or an email which outlines all of this information must again be submitted to maintenancejobcoaching.request@state.or.us to be reviewed. Prior to submitting the request, the service coordinator or personal agent or whoever in the case management entity's office authorizes services in plan of care should go into plan of care and authorize maintenance job coaching. This request will then pend for ODDS approval. Once ODDS has reviewed the request, they will either approve or deny the request. If the request is approved, the service coordinator or personal agent will be sent an email to let them know that the request is approved, and the authorization and plan of care will go from pending to authorized. In the event that the request is denied, the Office of Developmental Disability Services will send a notice to the individual letting them know that the request was denied and the reason that the request was denied. The individual will then be able to respond to the notice, including requesting a hearing if they choose. The service coordinator and personal agent will be kept in the loop moving forward. Again, it is important to emphasize that if maintenance job coaching is not approved, the person can continue to get support through ADL and IADL on the job if the person needs that type of support to be successful at the job. There are some special circumstances regarding the maintenance job coaching request. Because job coaching, ongoing job coaching in particular, was rolled out September of 2014, some individuals have already used the 18 months of ongoing job coaching available to them. ODDS has pulled the names of the individuals who have either received continuous support or intermittent support over 18 months of ongoing job coaching through February of 2017. This list has been sent to program managers and directors at both counties and brokerages. ODDS is requesting that counties and brokerages review the list. There are times when individuals may have changed jobs or there may be other circumstances, which means that the person has not actually used 18 months of ongoing job coaching. If that is the case, just let us know. However, if the person has used 18 months of job coaching or is anticipated to use 18 months of job coaching by February 1st, 2017, the request for maintenance job coaching must be submitted to ODDS by December 1st of 2016. It's important that this request is submitted by December 1st of 2016 to make sure that there's time to review the request before February 1st of 2017. During December and February, ODDS will be reviewing all of these requests and responding to either approve or deny the requests so that individuals will have time to know if their job coaching will continue, and plans can be made if the job coaching will not continue, either for ADL or IADL support, or if the individual does not continue to require support on the job, there should be discussion with the team around that. Effectively, because of the need to request the maintenance job coaching rate will not go into effect until February of 2017. If there are additional questions about the maintenance job coaching rate or how to request the rate, please do review Action Request 16066. There's a link on the PowerPoint for additional details. Moving forward, in order to help facilitate the request for maintenance job coaching, and also to help facilitate the strategy to help a job coach fade and the person become reliant on themselves, their peers, and others at work, just other than through paid supports, it's important to consider a step-down plan that may be written into the plan. For instance, when somebody goes from initial to ongoing support, the team may know that that person will need 3 contacts for the first 3 months, and then anticipate that for the next 3 months only 2 contacts will be needed, and that they may go into maintenance job coaching sooner than the total of 18 months. This type of plan can be written into the career development plan using the key steps or through provider implementation strategies or the service agreement. If the step-down plan is written in ahead of time, then changes would not need to be made to the career development plan through change forms, and these can also be authorized in plan of care earlier. While a step-down plan is not required for everybody, because it may not work for everybody, if somebody's new to a job, they may not know yet what their step-down plan would look like. It is encouraged that if the team has an idea about this, that it be written in ahead of time to save work later, as well as to make requesting the maintenance rate, if it's needed, easier. One question that we have gotten often, and a concern that's been shared, is that individuals may no longer need job coaching, and then something will happen in their life that will change. For instance, they'll have a change in supervision at work, or a change in their needs, or a change in job requirements, and there's concern that if they no longer have a job coach, that person may lose the job. For this reason, the job coaching policy actually has an exception to allow the maintenance job coaching rate to be authorized by a service coordinator or personal agent for up to 30 days or a month without prior approval from ODDS. If it's likely that that maintenance job coaching will be needed past the 30 days, then the maintenance job coaching rate must be requested as outlined in Action Request 16066 and is discussed in this training. This can happen up to 2 times in 1 year for the individual. So they may need maintenance job coaching for 30 days, and then 3 months later there's another change and they need maintenance job coaching again for 30 days. However, if it happens more than 2 times in 1 year, the service coordinator or personal agent must request the service be authorized by ODDS. Ideally, this will help support the person if they just have a short-term need for job coaching, or if they have an immediate need. This will allow the service coordinator or personal agent to authorize the service without any delay waiting for an exception, and if the need becomes ongoing, will give time for the service coordinator or personal agent to get with the team and make the request for maintenance job coaching, as well as time for ODDS to review so that the person does not lose any support. If there are further questions around the initial, ongoing, or maintenance job coaching rate or requirement, please do visit the Job Coaching Worker Guide, which is attached to Action Request 16066 and also on the Staff Tools page. As with any rate change, there are also plan of care changes that are coming. For initial job coaching, it's always only been allowed for a total of 6 months. For this reason, there's not a plan of care change that is needed at this time. Internally, we will update the rate to the new rate and roll it to the current plan line end date, so no work in plan of care should need to be done for initial job coaching. For individuals currently authorized for ongoing job coaching, the rate will also be updated and rolled to the current plan line end date. However, because job coaching may only be authorized for up to 18 months, this means that the service coordinator, personal agent, or other entity at the case management entity who updates plan of care should update the plan line to ensure only 18 months of ongoing job coaching is authorized. As plan of care only allows for annual billings, this will require tracking and alignment with the ISP over a 2-year period. Currently, the Office of Developmental Disability Services with ITBSU is working hard to come up with a report so that counties and brokerages can pull on an ongoing basis who has had ongoing job coaching for 18 months. For new authorizations or renewals of ongoing job coaching, the service coordinator or personal agent through the plan, as well as whoever at the county or brokerage authorizes plan of care, must ensure the service is not authorized for more than 18 months. As discussed previously, it is required that direct contact or face-to-face time is reported in plan of care. This requirement is outlined in Action Request 1540. It's also in the current Job Coaching Workers Guide. Again, direct contact time does require face-to-face contact, but does not have to be provided on the job. It could be provided before work, after work, or on a day the person does not work. In the event that direct contact time was provided on a day the individual does not work, this time should be reflected in plan of care billings associated with the next day the individual does work. For instance, if the individual works Tuesday, May 14th, but the direct contact time was provided Monday, May 13th, and the individual did not work Monday, May 13th, this time should be reflected on Tuesday, May 14th billing. Again, this is important because CMS will be monitoring to look at the direct contact time associated with the hours the person works to make sure that the assumptions built into the rate are accurate. If they are not accurate, we will have to revise the rate. Discovery rates cannot be rolled in plan of care. This is because currently there's only one rate for discovery, and the new rates are going to be based on an individual's tier. Additionally, discovery is a time-limited service and should not be rolled unless the authorization must continue. ODDS does not have a way internally to know this. It's important to note that all of the employment rates rolled out initially September of 2014 were based on the individual's tier, specifically Tier 1 through 6 and an exception rate for Tier 7. However, with the new rates, we are going to categories. This means that Tier 1 will coordinate with Category 1, Tier 2 and 3 will coordinate with Category 2, and Tier 4, 5, and 6 will coordinate with Category 3. There will still be an exception rate. For job coaching, because they were already associated with tiers, we're able to then roll them based on the new category. However, because discovery was not associated with a tier, we don't know for all individuals what tier they may be and therefore cannot associate them with a category. For that reason, authorizations will need to be updated by the case management entity. For individuals who started discovery on or before October 31st, 2016, discovery will be paid at the current rate of $16.80. Services that begin on or after November 1st, 2016 must be authorized at the new rate based on the individual's tier and category, as outlined in the expenditure guidelines. If discovery was authorized for an entire plan year without a start date, the start date must be determined and adjusted in plan of care to ensure the correct discovery rate is authorized for service. Please note, expenditure guidelines will be updated prior to November 1, 2016, but have not been updated as of the date of this training. Job development is typically provided through vocational rehabilitation. There's an exception in our waiver which allows the Office of Developmental Disability Services to pay for job coaching when VR is not able to. More specifically, if VR is to go into order of selection or a time in which they're not able to serve individuals. If that's the case, ODDS will be able to authorize job development. However, as it currently stands, job development must be approved before being authorized. For that reason, job development beginning November 1st, 2016 will pend in plan of care for ODDS approval. Because job development is not currently authorized very often, this should not have a large effect on plan of care changes. This should summarize all of the changes anticipated for plan of care. If there are further questions about plan of care, please do visit Action Request 16065. And that concludes the online training for the rollout of the new provider agency rates for job coaching, discovery, and job development. Thank you for participating. If you took this training on iLearn, you can print your own certificate to verify that you completed the training. If you have questions regarding the new job coaching rates or policy, please contact Acacia McGuire Anderson at acacia.mcguireanderson@state.or.us. And if you have questions regarding plan of care changes, contact Julie Harrison at julie.a.harrison@state.or.us. Finally, as part of this training, please do review the Job Coaching Workers Guide, which can be found attached to Action Request 16066 or on the Staff Tools page. There's also an action request on how to request the maintenance rate, Action Request 16066, and a maintenance job coaching request form that's attached to that action request. Rates will be updated in the expenditure guidelines by November 1st of 2016. And the plan of care requirements are outlined in Action Request 16065. All of these can be found on the PowerPoint as well as links. Finally, we hosted a call September 30th, 2016. This call generated some frequently asked questions, which can be found on the Job Coaching Workers Guide as well. Thanks again for your participation.